Relative contraindications to inserting a peripheral catheter in a specific site may include infection, phlebitis, sclerosed veins, previous intravenous infiltration, burns or traumatic injury proximal to the insertion site, arteriovenous fistula in an extremity, and surgical procedures affecting an extremity. Other situations may preclude obtaining peripheral intravenous access. For instance, extreme dehydration or shock may render cannulating collapsed peripheral veins impossible. Some patients may lack suitable peripheral veins because of prior chemotherapy or intravenous substance abuse. When access to peripheral veins is impossible, and in other situations in which accessing peripheral veins may take too long, insertion of a central venous or intraosseous catheter or peripheral venous cut-down may be required. A detailed understanding of the venous system of the upper and lower extremities will facilitate successful cannulation. The upper extremities have two primary venous systems: the cephalic vein, traveling on the radial side of the forearm, and the basilic vein, originating from the ulnar side of the forearm. Although venous anatomy may vary considerably from patient to patient, these two systems generally remain distinct, other than communicating at the antecubital fossa and the wrist. However, be careful to avoid inadvertently cannulating the brachial artery, which usually lies just medial to the median cubital vein. The same applies for the radial and ulnar arteries at the level of the wrist. Use careful palpation to identify arterial pulsations to minimize the possibility of this complication. The venous system of the lower extremities consists of the greater and lesser saphenous vein, cannulated in acute situations, as it accommodates large bore catheters and may be easier to cannulate. When upper extremity veins are inaccessible, the dorsal veins of the foot or the saphenous veins of the lower extremity may be used. Cannulation of lower extremity veins is associated with a higher incidence of thrombosis and embolism as compared with upper extremity veins. This risk is lower in children and infants. Therefore, the veins of the legs and feet are an acceptable alternative when cannulation of the upper extremities has failed. Other alternative intravenous cannulation sites include scalp veins, used in neonates and young infants, and the external jugular vein.